causes of breast cancer are not fully known. However, researchers have found factors that increase or decrease the chance of getting breast cancer. These are called risk factors. Breast cancer is complex and likely caused by a combination of risk factors.
Basically breast cancer, we're saying that this is cancer that has developed within the breast. And when we're talking about cancer, it's not just one disease, it's a group of diseases. And we name them according to the area or the organ from which the cancer has originated. But just to break it down a bit more, cancer is a disease of the cells. So when we're saying cells, we're breaking down our body parts to that microscopic level, where we look under the microscope and we see the smallest part of the human body called the cell. So it starts in one individual cell that goes bad. By going bad, I mean that it develops an ability to divide uncontrollably. Okay, so that's usually a genetic mistake that enables it to start growing. So it multiplies, you have 2 cells, then you have 4, then you have 8, and so forth, until you have a tumor that you can feel or see.
When I found out that I had breast cancer, it was not easy to digest. You know, cancer, just hearing the word cancer, one thing that comes to your mind is that you're going to die. One thing that is very important that I think you and I, we believe in, is that we are all spiritual beings. What really helped me is the spirituality bit of life. Just knowing that there's God and just knowing that there are people who have survived cancer. It gave me a positive mind. It gave me a fighting spirit, knowing that if somebody there managed to fight cancer and become a cancer survivor, I can also be a cancer survivor. That was the attitude that I took from the word God. But I don't want to lie. On the first day, I cried and cried and cried and cried. But thank God for the word of God. It actually prepared me.
Since you can only control some risk factors, you cannot avoid some amount of risk. Some factors linked to a higher risk of breast cancer are as follows: a family history of breast, ovarian or prostate cancer, a personal history of breast cancer including ductal carcinoma in situ, alcohol use, being a woman, being overweight especially after menopause, current or recent use for more than 5 years of menopausal hormone therapy, postmenopausal hormone use containing estrogen plus progestin.
We find that it's hormonally related, so there's certain things that women can take that actually increase their risk of developing breast cancer. So things like hormone replacement therapy, these are tablets that women take after they've reached menopause for some reason or the other. Okay, these can increase the risk of developing breast cancer. We're also looking at whether one has had children or not. We find that having children reduces the risk of one developing breast cancer. And not just having children alone, one also has to go ahead and breastfeed. And usually we're looking at breastfeeding for 1.5 years or longer. Actually helps to protect the breasts from developing breast cancer. And then one also looks at the age of when one had their first child. So having children earlier helps. So we're looking at women who've had children less than 30 years of age are more protected than women who have their children late. So we encourage women to have their children earlier. So those hormonal changes and hormonal patterns can actually affect one's risk of developing breast cancer. And then just to add on, things like alcohol drinking and smoking can increase one's risk of developing breast cancer.
Exposure to large amounts of radiation at a young age, getting older, high breast density on a mammogram, hyperplasia or lobular carcinoma in situ, lack of exercise, never having children or having a first child after 35 years.
So it's acquired from wear and tear of the body as we grow older, okay? So we're looking at things like our lifestyle. The kind of lives that we live actually affect whether we get breast cancer or not, okay? So whether we are active or just sedentary, and being sedentary predisposes us to obesity, which has been found to increase one's risk of developing breast cancer. we're also looking at the foods that we eat. It has been found that foods that are fatty, okay, so animal fats, are not very healthy. They actually contain chemicals and substances that can cause that genetic damage and result in the development of cancer. So you're looking at foods that are not natural. So the more natural our foods are, we need to go back to what we used to eat, years ago, what our great-grandparents used to eat, vegetables or fruits. We find those contain substances that can actually mop up those harmful chemicals within our body and reduce risk of developing cancers.
I had a lump in my breast, and then I went for a scan, and I was told that I had to go for mammogram. So for mammogram, that then said I have to go for biopsy. Biopsy is when they take a piece of you and then they test it. And then from there, I was told that I had breast cancer stage 3, and I had to go for an operation the following week. And because cancer it spreads, it was on a later stage, so I was told that I have to go for an immediate operation.
A woman whose mother, sister, or daughter had breast cancer has an increased risk. Having a male relative with breast cancer also increases the risk.
From where I come from, my father died of prostate cancer. My brother had cancer of the liver. So when I was told that I had breast cancer, I thought maybe I was the next in line, I was going to die.
When we're talking about cancer, the main challenge that we find is that we don't want to wait for one to develop symptoms. Why? Because when one has symptoms, a lot of the times it means that those cells I was describing that divide over time, they would have gotten maybe years to actually develop by the time you have a tumor or a lump that you can feel. So in a lot of cases, once you start having symptoms, the disease is already advanced. Okay, breast cancer and a lot of other cancers, we want to catch them before one develops symptoms, which is why we always talk about screening. But nevertheless, one needs to also be aware of symptoms. So the symptoms that we watch out for, we need to know our breasts, to know how they feel, and the earlier a woman or a girl starts to examine their breasts once a month, the better they are at knowing what normal feels like for that particular woman. And when there's a problem, now they're able to pick it up early. So we examine your breasts every month, once a month. For women who are still menstruating, at least 1 week after you've completed menstruation. For people who have completed menstruation, have reached menopause, they can choose a day of the month that they're comfortable with. It could just be the first day of each month, where they examine, and keep a diary to say I've examined on the 1st of January, 1st of February, and everything is okay, or I found a problem. Okay, so you're looking out for lumps. You check the whole breast, not leaving out any single part of the breast. Okay, from deep all the way up to superficial, you check the breast to look for any changes, any abnormalities, any lumps that you can feel. You also go in front of a mirror. You check to see if there are any skin changes. Okay, they can develop a rash. One can also find that they are bleeding from the nipple. That can be a sign of breast cancer. And then after checking your breast, you also check your armpit. For some women, it can develop lumps in the armpit, and one has to also just check their armpit not to forget that area. Okay, so having checked, one also needs to look out for any pain or discomfort that is abnormal. Okay, women usually have discomfort just before their periods, but that's where that knowledge of one's body comes in. If that discomfort is worse than before, then you know that you might have a problem and you need to go and get checked. When we're talking about treatment of breast cancer, we're looking at quite a number of factors that we take into consideration. Okay, so nowadays we're talking about treating cancer in a multidisciplinary sort of approach. So not just one specialist or one doctor treats that patient. So I encourage all women, once you've found that you have a problem and you've seen your GP sent for tests, you need to realize that the first person that you see is the one who will, yes, assess and give you advice, but there's need for a number of specialists to come together. So we're looking at your general practitioner, the oncologist, the surgeon, and other support services that come together and assess your condition and your status and your stage and decide what treatment you need to start with, because we've got a variety of treatments for different patients depending on how advanced that cancer is. So when we're talking about stage and how advanced the cancer is, we talk about stages 1, 2, 3, 4. So we talk about early breast cancer, where the cancer is just located and confined to the breast, or one can have advanced cancer that has spread to the armpit, the lymph nodes in the armpit, or even more advanced breast cancer that has spread to the other parts of the body, such as the lungs, the bones, the liver.
The first week I started doing treatment, my hair started to fall. I was bored for more than a year, and the chemotherapy drugs, they actually kill all any growing cell that is in your body. So I had problem with my nails. I would scratch. My nails they turned brown, and it was not easy for me. But being a positive person, I started to Google to see from the internet what I can do with my hands, so that I don't spend the whole day thinking about my cancer, thinking about how unlucky I am to have breast cancer. So that's when I started doing this. I started making mats. These mats I make them from beads and twine. I also started doing my macrame bags, and also decorating bottles in a way to exercise my hand, because I had my cancer was I discovered my stage on a later stage, and my treatment went over a year. So it was like more than a year not going to work, just staying at home, and I started doing all this.
Stage 1 cancers, those ones we advocate for the patients to undergo an operation that can either just remove the lump alone or remove the whole breast. Okay. For more advanced cancers that have spread to the lymph nodes, a lot of the times we want to add on more treatment, such as chemotherapy, radiotherapy, and what we're trying to do there is reduce the risk of the cancer coming back with these extra treatments. Chemotherapy being the use of drugs, anti-cancer drugs that try and mop up, to clean up the whole body, to reduce the risk of anything popping up later on in future. Radiotherapy, we're using special x-rays that are high energy to treat the area that the cancer came from. So that's usually the chest wall or the breast if one has just had their lump removed. And that is used to reduce the risk of the cancer coming back within that area and within the armpit area. And then if it has spread to the other parts of the body, and a lot of the times we're not able to cure that patient, we offer them what we call palliative care, which is managing the patient's symptoms, psychosocial support, and also offering support to the relatives. A lot of patients also have pain, so we manage pain as well. Those patients, we can offer chemotherapy to try and prolong life as best as we can, and also to manage symptoms as best as we can. Breast cancer is definitely on the increase. Okay, you'd find that previously it used to be the number 3 cancer, but now it's gone up to number 2. Okay, so it's the second most common cancer. Cervical cancer being the first. About a third of our women are suffering from cervical cancer, diagnosed each year, and then about 11% to 12% of our women are diagnosed with breast cancer every year, which is a very significant percentage. And unfortunately, about 80% to 90% of these women come with that advanced cancer that I described, not the early breast cancer. So in most women, it's not curable, which is an unfortunate situation. It is a very expensive disease to cure because of the need for the different treatments, surgery, radiotherapy, chemotherapy, all sorts of treatments that we offer a patient who has been diagnosed with cancer. So the best thing is to actually prevent it and not get the patient to actually have it in the first place. So prevention, we're looking at watching out for your diet, your lifestyle factors, avoiding alcohol and smoking, okay. But then be after prevention, we also look at screening. Okay, so with screening, we want to catch it before it has developed the symptoms that I was talking about. Okay, so screening, we've got quite a number of screening tests that we can do. The most important is the woman feeling themselves and examining themselves every month. Okay, and then the other screening tests, these are now tests that we do. We've got what we call a mammogram. This is a special x-ray that compresses the breast and takes an x-ray of the breast to look for any abnormal patterns that can point towards one having cancer. One can also have an ultrasound scan of the breast to look for any abnormal lumps within the breast. These screening tests are available in the different hospitals, government hospitals and private hospitals. So we've got our main government central hospitals and some provincial hospitals. They now have mammography and ultrasound scan screening tests for the breast, and most private hospitals are now offering that. In terms of the expense, in the private hospitals, the medical aids do assist for patients on medical aids, but you'd find that it's definitely more expensive than when one sources for it in the government hospitals. The services are still not adequate, but the government is working on ways of actually improving access to more people, because this is a countrywide problem.
You face a lot of stigma if you are a cancer patient, from the society, from people. They see you different. And I remember one day when I was just talking to the young girls when I was doing my cancer campaign, and one of the guys was not really ready to marry somebody with one breast. You know what happens is, a long time ago, people who were detected with cancer were those who were past 40 years. But with our lifestyles, people are now being diagnosed with cancer at an early stage. Some below 20, some in the middle 20 to 30. And for myself, I was 37 years old. So the society, it needs to be educated about cancer. The young boy, he was only 1 year old, but my daughter was in grade 4. It affected her. Just knowing that mommy is sleeping, mommy is not going to work, mommy is going to South Africa for treatment, for an operation, and at one time I was called at school to just explain what was going on, because it was affecting her studies. I would like to thank God because I got support from my family, I got support from my husband, I got support from my children. You know, it's very difficult when you spend the whole day in bed. Every week you have to go for chemotherapy, you can't cook, sometimes you don't like the smell, but my family was there for me. I had to change the diet for everyone. People had to, in fact, most people in my family, they're no longer eating sugar, and it was all in support. And I remember when I had bored here, my husband, all in support. And also I'd like to thank God for people at church. They were very supportive. My apostles, they were very supportive. People at work, they were very supportive because they gave me time to go and rest at home while I was getting treatment.
Make healthy lifestyle choices. Maintain a healthy weight. Add exercise into your routine. Limit alcohol intake. Limit menopausal hormones use and breastfeed if you can. While the risk of breast cancer increases with age, all women are at risk of getting breast cancer.
Fruits generally, we're looking at all fruits. Anything natural is good. Okay, so it's the more, your unnatural products that are not good. Yeah. So you're looking at your apples, your bananas, guavas, even your traditional fruits from Kumusha, Matamba, any fruit is good. We do advocate. Fruits contain special nutrients and vitamins that help to clean up those toxins within our bodies. So one can have a variety of fruits in a day. We usually advocate for 2-3 helpings of fruits per day. Yeah, and also vegetables, whether salad or whether it's your cooked vegetables. It could be your red kovo or it could be broccoli and things like that. Yeah.
Cancer feeds on sugar. So one thing I did was to eliminate sugar. I take my tea without sugar. I take my porridge without sugar. Once in a while I eat cakes, but already my system, if I eat cakes now, it rejects. I sometimes have a running tummy. I've limited on my fat intake. I eat once in a while fried chips, and most of my like vegetables I just boil them and eat them. And one thing also that I've changed in my lifestyle is I now exercise, I now drink a lot of water, and which has helped me a lot.
I urge all women to have a self breast examination. That is, you can feel your breast using your two hands. If there's anything abnormal, you should seek help urgently. Early detection saves life, and early treatment also saves life.
Baripanze, what I can tell them is early detection saves lives. It improves your prognosis and also a survival rate. Be in the couch of examine yourself. If you detect, if cancer is detected early, it can be cured. But if you wait and you are detected at later stages, which is normally the case, stage 3 and stage 4, your survival rate is very minimal. And I would like to encourage women not to fear. There's fear and stigma which is around this word called cancer. But be in control of your life, be in control of your life, of your health, of your lifestyle, health, exercise, improve on your diet, drink a lot of water, and you see that you will survive cancer.